Hi, I'm Jim Mold, and today I'm talking with Ed Bujold, who's a family physician, has been in practice in the foothills of the Appalachian Mountains in Granite Falls, small town, for 40 years. A full spectrum practice other than obstetrics. Still takes care of people in the hospital, in their homes. I came to know Ed because he wrote a book about some of the most famous researchers in the field of family medicine. And then subsequently, we got to know each other because Ed has been involved in practice-based research himself. And so we met at national meetings of the North American Primary Care Research Group and also the National Research Network. Um, Thanks for talking with me today, Ed. Tell me how you first came to hear about goal-oriented healthcare.
It was through the National Research Network and NAPCRG, North American Primary Care Research Group. You had been a featured speaker in both those settings at one time or another, and um, some of the things that you talked about just really attracted me to, thinking about things in a different way.
And how different is that way? I mean, you've been you because you've practiced for so long in the same place. You have gotten to know people really well, have taken care of multiple generations, I'm sure, of families. Um, did any of what I said make you think about what you had learned to do as a family physician? I mean, is this was this totally foreign, or was it just a different way of explaining it?
Well, no, it wasn't totally foreign. And it, I remember the first NAPCRG meeting I went, um, people were talking about things that happen in my world. You know, it wasn't about didactic lectures about tuberculosis or heart disease, but really more about how to take care of people and how to help them maximize their health and help them reach the goals that they wanted to reach. Um, and none of that was something that we were taught in medical school.
Does it help to have some language around it? I mean, this conceptualization that I've been working so hard to articulate, is it helpful to sort of put words around what you learn to do?
I think it does, although it's difficult to describe. Um, I find younger physicians are so caught up in documenting electronic health records and CPT codes and prior authorizations, and it's like they forgot about the patient. They forgot the fact that these are real people and they have real lives, and um, they forgot how to talk to them. And as a result, patients are very frustrated.
I agree. So, what do you think? What do you think the solution is? Do you think that this approach of focusing on goals is a way forward?
It is, and I think the patients are more receptive to it than the physicians are,
I've
which
found
is very disappointing.
Yes, I found it much easier to explain to patients than to physicians. It's or anybody other than a physician is very easy to understand, but easy to explain. But to physicians and just not been trained that way.
Well, and they're not incentivized to provide this kind of care. Um, it's all about DRGs and maximizing CPT codes with documentation and electronic health record. And I mean, that has nothing to do with actually taking care of patients.
Give me a recent example from your practice.
Um, well, a couple times in the last month, I've had long discussions with two people that have stage 5 renal failure. And earlier in the last 3 or 4 years, when they were in stage 4 renal failure, we talked about, the options, and they both said, I don't want to be on dialysis. I said, where do you think this is going? They said, well, I don't want to be on dialysis, and I want you to allow me to live as well as I can live for as long as I have to live. And then when time comes, you know, I'll make that decision about being in hospice and ending all of this. And they were so grateful, that I asked them what their plan was instead of me dictating to them, this is what we should do. I mean, I can't tell you how grateful they were.
And what if you had not agreed with the plan? What would you do then?
Um, I can't remember really n not ever disagreeing with what somebody wanted to do. It's their life, it's not my life. I remember another patient that had chronic lymphocytic leukemia and lymphoma, and he started to get worse and worse, and I could tell he was struggling. He was feeling like his end was near, and I could tell he was struggling about what we were going to do. He had been through so many procedures and he was getting tired, um, and I said, Bill, you know, this is your life. I'll make happen whatever you want to do. And he actually broke down and cried. And he said, I'm so grateful. And it changed the whole nature of the rest of his life, which didn't last much for very long. And he actually made me his power of attorney, his healthcare power of attorney,
Yeah,
which I was stunned actually, but I think he felt that good about what we had talked about.
yeah, I've had that experience also. It's very humbling. I know
Very.
that you're sort of at this stage of your career, you're spending more and more time teaching medical students and residents and fellows and so forth. Do you think that this goal-oriented care concept might be useful in your teaching?
Oh yeah. Um, and I think residents and students that have not had any exposure to a physician that's been in the same location for 40 years and has 3 and 4 generations of people that he's taken care of. And they've actually seen several examples of people coming out of rooms and saying, you need to listen to what this doctor has to say, um, because he practices medicine the way we think medicine should be practiced. And I actually try to introduce them to both of the books that you've written, um, to get them more exposure, to this type of healthcare.
That's great. No, I really appreciate that. And thanks for talking with me today. Uh, hope to see you again soon, hopefully out in the mountains. Um, it's a beautiful, beautiful setting. Have a great day.
All right. Thank you.
Uh-huh.